My name is Dr. Michael Dulin. I'm an anesthesiologist at Good Samaritan Hospital in Vincennes, Indiana. In April of this year, I developed some sharp pain in my left hip, and it got worse and worse. I got an x-ray, and it shows severe osteoarthritis, and it got to the point where I was having trouble walking in the hall. So I saw Dr. Dave Miller in the hall, and I said, "Dave, do you have time to give me an injection? Because it's hard for me to see my patients and do my work." And he said he would, so I went directly to his office. He injected me with a steroid solution, and immediately it worked. About 2 months later, I got another injection, and he said, "Now's the time to get your hip fixed." So I took his advice, and about 6 weeks ago, I underwent surgery, a total hip replacement, and I did it as an outpatient. I'm glad I did. Recommend it to anybody who has to have a total hip replacement. It was just very well done. I came in the morning to the OR, and they started an IV. They also prepped me. My anesthesiologist was Dr. Alan Hendricks. He did a spinal anesthetic and then kept me sedated throughout the whole surgery. I think the whole thing took about 45 minutes. And I was taken to the recovery room for about 30 minutes, and then I went upstairs, and maybe 2 hours later, they asked me to walk. I had a walker, and I walked through the halls, and very little pain. I think the whole day I had one pain pill. And when I went home, I think I had one more pain pill later on that week, and that's all I've had for the whole 6 weeks. I talked with the nurses. I said, "I feel up to it." And they said, "Okay." And I walked around the floor some more. And finally they said, "I think you can go home." So I did. And I had just a few steps to go up to my house. And actually things worked out very well. Well, I do a lot more now than I ever could before. But I virtually have no pain. So the first thing I did, when I could, I came back to the trails here at Wabash Trails Park, and I've been walking up steep hills with absolutely no pain whatsoever. The first week post-op, I was with a walker. The second week, I had a cane. After that, I had no support whatsoever. And again, I had zero pain.